In short, it can handle these things just like you can in a more traditional fee-for-service practice. So I have the ability to refer patients and write prescriptions and send folks to the hospital just as I would in a traditional practice. So that's the first thing to speak to. But because we have more time in direct primary care models and we're so focused on delivering a really good experience for the patient, for the customer, we really try to curate this process on behalf of our patients much more than I would have ever had time to do in a traditional model. The second piece that I generally think about in terms of handling those things is direct primary care is really built around this idea of cost transparency and delivering good quality. And in traditional healthcare, really the idea of what something costs is for the most part pretty arbitrary. And so because we're oriented around trying to have transparent, very clear upfront pricing, when it comes to things that are outside of our walls, we seek that same degree of transparency because we want people's experience. We want how it impacts their wallet, and also kind of how it impacts them from a quality perspective to be as optimal as possible, because we feel like it reflects poorly on us if they come back and the experience is otherwise. And so that's how DPC handles those things.